Hello, everyone. It's Friday, January 21st. It's hard to believe it's year 2022. I mean, especially if you're someone my age and everything, you know, the years just go, and it seems like they go faster and faster. And but we're thankful to be here and be with you. But again, I thank everyone over and over, and I'll never forget it. All the outreach, you know, from people and their cards, their well wishes, and everything, and most importantly, their prayers. So thank you again. We have lost an additional 33 people since I was here on Wednesday with you, and that brings our total death total in West Virginia to 5,609 folks, and it's a crying shame. But I'd ask you again to join me in prayer for these people and all their loved ones and just friends, everybody. It's just it's tragic beyond belief. But the 5,577th death in West Virginia is a 64-year-old female from Raleigh County. The 5,578th death, a 65-year-old male from Braxton County. The 5,579th death, an 81-year-old male from Mason County. The 5,580th death, a 78-year-old female from Wood County. The 5,581st death, a 78-year-old female from Marshall County. The 5,582nd death, an 82-year-old female from Raleigh County. The 5,583rd death, a 77-year-old female from Marshall County. The 5,584th death, an 86-year-old male from Wood County. The 5,585th death, a 47-year-old male from Raleigh County. The 5,586th death, a 71-year-old male from Grant County. The 5,587th death, an 86-year-old male from Marshall County. The 5,588th death, a 78-year-old male from Mineral County. The 5,589th death, a 73-year-old female from Wood County. The 5,590th death, a 66-year-old male from Putnam County. The 5,591st death, a 77-year-old male from Raleigh County. The 5,592nd death, a 76-year-old female from Raleigh County. The 5,593rd death, a 94-year-old male from Barber County. The 5,594th death, a 76-year-old female from Marion County. The 5,595th death, a 61-year-old female from Kanawha County. The 5,596th death, a 76-year-old female from Preston County. The 5,597th death, an 85-year-old female from The 5,597th death, an 85-year-old female from Kanawha County. The 5,598th death, an 80-year-old female from Calhoun County. The 5,599th death, a 61-year-old female from Berkeley County. The 5,600th death in West Virginia is a 76-year-old male from Kanawha County. The 5,601st death is a 91-year-old female from Monongalia County. The 5,602nd death is a 66-year-old male from Greenbrier County. The 5,603rd death, a 53-year-old female from Barber County. The 5,604th death, an 86-year-old female from Kanawha County. The 5,605th death, a 70-year-old male from Boone County. The 5,606th death is an 87-year-old female from Marion County. The 5,607th death, an 84-year-old female from Berkeley County. The 5,608th death, a 55-year-old female from Berkeley County. The 5,609th death is a 79-year-old male from Hancock County. Today's a little different. You know, if you just think about it, you know, I could be wrong about this, but I believe the youngest person that I read today was a 47-year-old. I think that's right. But today, you know, the list was predominantly folks that are our senior citizens. But we all know that just the other day that I read a 21-year-old or 30-year-old and whatever, and it's tragic beyond belief for all, for our senior citizens as well as our young people. It's just something that we've got to keep battling to get through it. And I know you're going to do that, but I want to urge you all the time to know that we're going to get through this. You know, this is all there is to it. We're going to get through it. You know, the really super minds of the world are working every day to come up with, you know, just the very thing that can just stop it in its tracks. But at the same time, we've all got to realize these vaccines or whatever are good, and they're going to give us time. They're just bridges that gives us 4 months, 6 months of additional time so that super brains can come up with a real cure for the whole situation. Today in West Virginia, we've got 16,742 active cases. We had 5,335 new positive cases in the last 24 hours. Our daily positivity rate was at 23.78%. Our cumulative percentage rate is at 7.55 now. We've had almost 385,000 people that have been infected with COVID that have recovered. We have right at 1,000 people in the hospital. 980 people are in our hospitals now. We have 228 in the ICU units and 131 patients that are on ventilators. And overwhelmingly, the majority of all those people are unvaccinated. But, there are several that are vaccinated. Just because you're vaccinated doesn't give you the immunity to say that you're not going to get this period. But it stacks the deck in your favor. I'm living proof of that. It stacks the deck to keep you out of the hospital if you get sick, and it stacks the deck to keep you from dying and gives you the best odds that you can possibly have. I still strongly encourage vaccination. Omicron is absolutely now running awfully hard in West Virginia. Our National Guard has stepped up, and they're staffing our hospitals and helping us every day. Right now, as of this morning, we have 121 Guard members that have been authorized to deploy to 16 different facilities in West Virginia, and all the data is up there on our dashboard. I remind you again, gosh, I couldn't be more of a testimony to this now, that if you're 65 and above and you get any symptom whatsoever, you got to get tested. You've got to get tested immediately to where we can at least have the chance to be able to give you these antibodies because they'll save your life. I encourage you about wearing a face mask. If you're in a crowd of people indoors and everything, people you don't know and everything, you're 65 and above, you have any health issues whatsoever, I encourage you about wearing a face mask there. This is what I encourage you on more than anything, and I've said it 1,000 times. If you absolutely got both of your shots, I don't care if you were 18 or you were 86. I don't care. If you absolutely opted out to get both of your shots, Pfizer and Moderna, or one shot of J&J, how in the world can you not get your booster shot? I mean, somebody tell me the logic behind that. If you made the decision to get fully vaccinated, knowing that all the medical teams around you are saying to you, if you're 6 months out from from Moderna or Pfizer, you're basically walking around like you're not even vaccinated at all. If you're 2 months, I think it's 2 months out of J&J, same thing. What in the world are we waiting on? I mean, how can it be logical that you made the decision to be vaccinated and now absolutely you're just waiting, and in many cases it's because we're so busy, we're running in so many different directions, and we just think, well, the Omicron virus is not as bad as the Delta thing, and so, I'm really just not going to do that right now and everything. You're making a real mistake. No point in me going back through the numbers are about the same as far as the percentages of people that are vaccinated. I encourage, our parents and grandparents to help me with the kids. I mean, we need to get more and more kids across the finish line. It'll just help us in every way. I just looked, can you maybe pull up our map and everything, Jordan, real quick? because our map, for all practical purposes, is orange or red, one of the two. I can't recall seeing it worse than that. You know, one yellow county, every other county in the state is either orange or red, or gold or red, rather. You know, I can't recall seeing it that bad. But nevertheless, we try to give you all the facts. You know, I've not hidden a thing from you. I've been as transparent as I can be. We've told you, you know, we've pivoted, we've moved in all kinds of different directions, trying to keep you abreast of everything and keep you as safe as we can possibly keep you. But it doesn't take a rocket scientist to look at that map and say, you know, if I'm not boosted, I need to go get my booster shot. Or if I'm not vaccinated, I need to really think about it, because that doesn't look good. Okay, all the information is up on our COVID vaccine info line, and you can go there and get all kinds of information. I encourage you about getting tested. You know, the free testing is still available. I always thank Frith and Walgreens for all that they've done, especially in the beginning. They were real superstars, and I really can never thank them enough. You know, the Biden administration now is offering the in-home testing kits and offering 4 per home. And all you have to do, you know, if you want to get those, is to just go to our, is this the COVIDtest.gov? Is that where they go to? You know, I think that's where, and you know, so all you got to do is just go into that, and they'll send them to you, and you know, but I do think the more we test, the more we know. You know, the more we know, the better we're going to be prepared. You know, that goes way, way back. You know, I said over and over and over a long time ago, the more we test, the more we learn. The more we test, the more knowledge we've got. So all that's going to do is just help you and help all of us. We have 143 outbreaks in our long-term care facilities. I think that's the same as the last time I was here. We have 2 outbreaks in our church community. I think that was the same at Kanawha and Nicholas County as last Wednesday. But this one's really moving. In corrections right now, we've got 519 inmate cases and 179 staff cases. That's jumped way up. And so we're on it, and these people have done a marvelous job, and they're going to stay on it because these people deserve our attention as well. From the flu vaccine, I encourage you to get that as well. Right this minute, you know, I've got my daughter Jill and her husband have both tested positive for COVID. You know, and Jill also tested positive on, you know, for the flu as well. You know, so I encourage you, get your vaccines. Now, in both their cases, they were fully vaccinated with, you know, from the standpoint of COVID and everything. But you need to get your flu shots. You need to get your vaccines. The rental assistance program is still there and still available. You know, I don't know exactly the dollars that we have left and everything, but they're really substantial. I encourage anyone that's a renter or a landlord to get in touch with us and see if you qualify for those dollars. I encourage you about giving blood. You know, it's really, really important. You know, and so we can all do more there and everything, but you know, if you're a physician or whatever says you're healthy enough to give blood and everything, I think that's what you should be doing. Today's a real, you know, a good day. You know, the one of the ladies that signs, interpreter and everything that we have, her name is Julie Turley. And Julie's birthday's today, and you know, we thank Julie and Jennifer so much for the great job that they do, and I'm really proud of them. I always talk to them before they leave, and I call them my allies. You know, a lot of times these two are really just the greatest, and so we thank you so much. We're really proud of you. Thank you so much. Happy birthday. Okay. Now this one, I want you to dial in, really pay really close attention, because I love this. This is so good, it's off the chart. We have a 17-year-old graduate from our second Mountaineer Challenge Academy. Now, and just think about this. This is the National Guard taking kids that are a little bit at risk and everything, or maybe just having a little trouble in a lot of different ways. And they're absolutely taking them through their program, and it is amazing what they do, amazing. But there's a young man, his name is William, and I think this is Farkas. But William is a 17-year-old that is a recent enlistee in the West Virginia National Guard and a Tunnelton, West Virginia native that will embark on a journey that you can't imagine. He has been selected to go to West Point. He is a Mountaineer Challenge Academy graduate, and he has now received an appointment to go to West Point. It is amazing. It is so good. It is unbelievable. So, William, I'm telling you, we are so proud of you, and we are so thankful to our great National Guard. I mean, look at the job these people are doing. It says here that William Farkas was a standout cadet during his time at the Mountaineer Challenge Academy South in Montgomery, West Virginia, the state's second academy for at-risk youth. He earned several awards, including the Robert C. Byrd Distinguished Cadet Award and the Adjutant General's Award for Academic Excellence. So, William, congratulations to you from all West Virginians on this incredible accomplishment. And I, again, thank the National Guard in every way. I mean, you have absolutely touched lives. You've changed lives. It is amazing what you've done and everything. But absolutely, William, way to go. Way to go, son. That's great, great stuff. You're on your way now. And use this as a launching pad to just go on and do more and more greatness. We're really proud of you, son. Okay, here's a nice announcement, too. We have set another all-time record in the state of West Virginia, and you probably saw this come out yesterday, but December, our unemployment rate, seasonally adjusted unemployment rate in West Virginia dropped to 3.7%. It's the lowest monthly unemployment rate in the state history, and we've done this now, I think, 3 months in a row. There are many, many, many more West Virginians that are going back to work, and that's really great. We just need more people in West Virginia, don't we? I mean, if we're approaching an unemployment rate of zero, we need more people, and that's what we got to work on. And we're absolutely solving that riddle right now for the first time in probably decades. But actually, people over the 10-year period, maybe from 2010 to 2020 and everything, we lost 43,000 people in West Virginia moved out. 43,000. So for the first time, I think in 2021, we had, 2,600 or 2,200 people move into West Virginia. First time in forever. But we're moving, and we're moving the right way, but we just need more and more and more people to come. And this unemployment number is just fantastic. It says for the last 10 straight months, West Virginia's unemployment rate has been better than the national average. And I think we've gone down in our unemployment rate now 20 consecutive months. Not only is the unemployment rate better, but we are absolutely generating more and more and more revenues in the state that we can do all kinds of great stuff with. That's our surpluses and everything, but we love it that West Virginians are going back to work. But the last thing I'd add is who in the world, I don't care where it may be. I read a card of a nice lady that had moved here from New York the other day and everything, and she was so happy, and she said, the people here are so nice. Well, daggum right they are. They're the greatest people on the planet. Every single one of you are the best of the best. You're faith-based, you're low crime. You know the difference between right and wrong. You're not absolutely running your life this way. A lot of times now what we've gotten to in the United States or maybe in the world is it doesn't matter if it's right or wrong. It just matters what you can get by with. Well, that isn't the way West Virginians think. West Virginians are hard workers. West Virginians get their hands dirty. And West Virginians know how to work and know how to appreciate jobs and appreciate one another. So So this is all great stuff, and I'm really proud of you, West Virginia. You can see I'm jacked up, but I'm stuck on all the time, and I just love it. You know, I love the fact, you know, that you're doing good, West Virginia, and so many of you have pulled the rope, and we've all jumped in together, and let's just keep at it. Last thing I got here is just the announcement and everything that I'm going to deliver the State of the State address next Thursday, January 27th at 7 p.m. And it'll be a little bit modified because a lot of the stuff, you know, is already out and everything. But I do feel an obligation to come in front of our Senate and our House and deliver that message. And there's several things that are not out quite yet and everything. But it is the first time in history, you know, that we had to submit a letter, you know, that was basically outlining maybe a couple of the things that are in the State of the State and everything. First time in history that a governor has not addressed the Senate and the House, you know, in person and everything. We did it by letter and everything. It surely wasn't by choice. I'll promise you that, because I wanted to be there so bad it was unbelievable. But can you just imagine? I mean, the likelihood of the day before the State of the State just boom out of nowhere and everything, you know, COVID. Well, it's been difficult. It's been difficult on all of us in lots and lots of ways. But you know, we'll handle the State of the State, and we'll take care of the affairs as we already have. But really and truly, when it really boils down to it, whom is this has really been the toughest on? Just like today, you know, we read through, and I think the grand total was 5,609 folks now we've lost in West Virginia. We'll handle the State of the State. The state of West Virginia is cooking. The state of West Virginia is doing great beyond belief. And absolutely, we're so proud of that, and so many people need to be thanked. But along the way, we've lost 5,609 people in West Virginia. And so that's where our prayers need to be. Everything is good within the state of West Virginia, and it can just get better and better and better, and that's what we want it to do. So we're going to keep it going, and I told you early on, I promised you a rocket ship ride, and the rocket is rolling now, and you're riding on the rocket, and it is really fun, and it's just going to get better and better and better. The only way we're going to screw this up, in my opinion, is getting our own way, and I'm going to try every way in the world to assure that doesn't happen. That's all I got right now. Thank y'all.
Thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. In reinforcement of a few of the messages the governor has sent, it's important to recognize that our hospital numbers in West Virginia are going up. Across the country, in some of the earliest hit places, more urban, with the Omicron variant, there is a plateauing of some of the hospital numbers in those places, but our number is rising up. We're at 980 people today with COVID-19 in West Virginia hospital beds, and we anticipate seeing that continue to rise. Remember, our all-time high number of hospitalized COVID patients is 1,012, and it's very likely we will exceed that at a time in which we are more challenged with short staffing than we've ever been before. The governor talked about the importance of vaccination, and there's some important research that's come out in the last few days that really very much reinforces the power of vaccination and boosters. New data from the CDC demonstrates that people who are 50 to 65 years old, who are fully vaccinated and boosted, have a 44 times less rate of hospitalization than people that are not vaccinated. People over 65 years old have a 49 times protection against being hospitalized versus people that are unvaccinated. 49 times reduced risk if you're vaccinated and boosted. And if you're over 50 and you're vaccinated, but you're not boosted, you still have a 17-fold increased protection against hospitalization. So the protection with 2 vaccines is about 17 times if you're over 50 years old, but the protection with 2 vaccines and a booster is between 44 and 49 times less likely to be hospitalized. So the clear data is that we need people particularly people in that most susceptible age group, to get vaccinated if you haven't chosen to be vaccinated yet. And please also choose to be boosted. Really makes a huge difference. Data from Israel also suggests that children who have had 2 vaccines had a 50%, half the rate of infection with COVID-19 than those that did not have a vaccine, have the 2 doses of vaccine. And children that were eligible that had 2 doses of vaccine and a booster had about a 75% reduction in the risk of catching COVID-19. So it's really important as we talk about the impact on our pediatric population that we also try to really help have our children be vaccinated at much higher levels. In West Virginia, when we talk about the 5 to 17-year-old group of folks being vaccinated, I believe we're at about 30% 1 dose and 23% 2 doses, which is way, way too low. The other piece of research that came out that should help people choose vaccination is research in about 2,100 married couples who were having children and looking at fertility rates. And what they found was that not only did vaccines not impact fertility rates, in fact, they helped fertility rates as men who had been previously infected with COVID-19 within 60 days and not vaccinated had an 18% reduction, those couples did, of being able to conceive. So getting COVID looks like it's much more of has much more negative impact on the ability to get pregnant than being vaccinated. And so there was really no negative impact of vaccination. So that, I hope, will help reassure people who are childbearing women and also younger men or men who are looking to conceive with a partner that the vaccines are really very helpful in getting pregnant and don't have any deleterious effects. So I think that the real message today is that we still have not seen the peak of COVID-19, the Omicron variant in West Virginia. Our hospital numbers are rising, and our basic mission is to save lives and to make sure that we protect the capacity of our hospital systems. And emerging data in adults and children suggests that vaccination and boosting, when eligible, are the 2 most important things that we can look to try to see this pandemic become endemic. The last thing I'll say is there's been an interesting paper in the journal Nature, which is one of the most respected journals in the scientific world, looking at folks who have used advanced modeling techniques to look at deaths from this pandemic. And the estimate is that we've underestimated deaths globally in this pandemic by somewhere between 12 and 22 million, using both advanced artificial intelligence approaches and also looking at excess mortality rates in these areas. So it really does underscore the incredible impact that COVID-19 continues to make across our world and in our country. And yesterday we lost about 2,500 people. So we can't forget about that impact. And the way we prevent that is to be vaccinated, boosted, and to be careful out there wearing a good quality mask if you're indoors. Thank you.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just highlight and reinforce the effort going on as Governor and Dr. Marsh pointed out. Hospital numbers continue to rise. As the Governor pointed out, the National Guard has done a terrific job in pivoting, as they always do, and adapting. The 126 that the Governor mentioned there, by the end of this day, we will probably have about 200 guard assignments for individual guardsmen. Additional guardsmen are being trained thanks to the work of the Guard, General Crane, General Holt, Colonel Hatfield, and that team, and the work they're doing with Jim Krantz and Joe Peel to get those folks located and trained appropriately. And again, just I think it's important to point out that the men and women of the Guard are more than happy to support those frontline healthcare workers, just like they've supported those frontline public health workers throughout this pandemic. Related to vaccines, as the governor pointed out, it's somewhat baffling that if you haven't received your booster yet, that you really ought to go out and get it. This week is the first week since we've been tracking vaccine intake that we have seen it less than 0.1% a day increase across our age groups. So while I understand the weather has been a challenge, just heed what Dr. Marsh just explained, what the governor talks about all along. Getting vaccinated and getting the boosters are the most significant opportunity we have to address that number that the governor highlighted today, 5,609 great West Virginians that we've lost. And we'll get some more data related to this, but the unfortunate circumstance is, if we stop and think about it, that first week that we were involved in this, the projections were 64 West Virginians. And we were up in arms, and the governor was talking about how that was 3 times the number of people we lost in some of our more significant mining accidents. We are potentially going to approach 100 times that number before we come out of this. The last thing I want to point out related to COVID response therapeutics, we've heard a lot of chatter about concerns about therapeutics. So I just want to put it in these terms, make sure everybody fully understands. We are not getting the number of therapeutics that we need, but that is based on a national supply chain issue. Out of 66 jurisdictions that receive therapeutics on a regular basis, we rank 26. So concerns that there may be some politics involved or politics involved in distribution within the state, it's my responsibility to the governor to make sure that those things don't get brought into this. And we are working as hard as we can, and the governor has given us the authority to use the full power of his office, and we work particularly with our 2 U.S. senators almost every day to attempt to get more therapeutics. So I want to make sure that folks understand that. And the last thing is, Governor, I just want to tell you, personally, I appreciate the story from Challenge Academy. As you are familiar with, we started the process to get a seat, and at the national level, we're told, hey, this is probably not going to be something you can do. But you pressed that issue and led with legislative leaders, with Senator Capito and with Senator Manchin and Congressman McKinley as co-chairs of the National Challenge Program organization to get that done, and to now have a young man to be appointed to the military academy out of there is truly monumental for the state of West Virginia. So I appreciate that leadership and that effort. Thank you.
All right, thank you, General Hoyer. Secretary Bill Crouch is also joining us today and is available for questions. Dr. Inamjad had a prior engagement and will rejoin us next week. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good morning, Governor. Good morning, everyone. Before I get to my question, I want to mention John Hill, a friend of mine who passed, and I'm doing his eulogy tomorrow. John, in his earlier life, was a West Virginia National Guard member, and he was the pilot of the helicopter for Governor Arch Moore in his first term. Now the question, Governor, how's your stamina? Usually during a legislative session, it's pretty tough. You're taking calls at all times of the night during a normal session, but you're recovering from COVID, and you're also managing a pandemic. Does Kathy draw the line on you? Does she say nothing after 7 o'clock? How's that working out for you?
Good Lord, Paul. Lots of days, every day. I mean, are you kidding me? Stop at 7 o'clock. There's no chance on God's earth. You know, you know, I'm taking calls every night, 7 days a week till probably midnight. And you know, but I love it. You know, I've done this all my life, but and I guess if you get, you know, if you get believing that you can only do, you know, so much from 9 to 5, you know, that's all you're going to do. But I work all the time, you know, and I'm up and going about 6 in the morning, and then and really and truly at midnight every night of my life you can get a hold of me. So you know, and I love it, and that's what I've always been. You know, a lot of people think, well, you know, how in the world can he do it, you know, from the standpoint of energy? But I've just been blessed. I've really been blessed to always have that. I've not been sick very often at all, and I've surely not been knocked down like I was, you know, a couple weeks ago, and with this. But no, Paul, I feel great. I feel great. I'm ready to go, and you know, I just want to keep going.
All right, thank you, Paul. Next, we'll go to Jess Mancini with Ogden Newspapers.
Thank you, everyone, for taking my question. Governor, do you have a reaction or comment to House Bill 4071 that would eliminate any mask or testing requirement in the public schools? And if that bill was to happen to pass the legislature, would you sign it or veto it or let it go into law without your signature? Thank you.
Well, let me comment this way. You know, our local school boards have done well, have they not? They've made a lot of really good decisions, and along the way, I don't think that. I don't think we had an adverse decision that I can recall that where everybody got up in arms about it and everything. I really do not believe we need to have mask mandates at our schools. I really believe that, and I'm sure a lot of good legislatures believe the same thing. And but we got a lot of really important stuff going on here, and so, you know, we're going to watch it. We're going to continue to watch it as it goes through and all that kind of stuff. And we'll see, you know, what the final outcome comes out to be. I'm not for, you know, mandating masks at schools. I'm not for that at all. But I really believe that you know, we made the decision to have local control, and I think those folks did a heck of a good job. You know, and my only comment would be just simply this. We got a lot to do here, a lot to do, and you know, I go back to, you know, if it ain't broke, don't fix it, and you know, really and truly, or don't try to fix it, but you know, our local people did a good job, and you know, that's all I can say. But we'll watch this and we'll make a decision on it when it finally comes out.
All right, thank you, Jess. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question. I have a question for Dr. Marsh, if possible, and the governor may want to weigh in. Once again, we're getting some mixed messaging about the types of masks we need to be wearing. While there is some recommendation to wear masks if you're older, if you have symptoms, if you're in an inside or in a crowded room, we've heard from various people over the past several days, including members of the Biden administration, that cloth masks just aren't very effective. So the gaiters or a kerchief or, you know, the mask even that I'm wearing today, a cloth mask, isn't very effective. And we've heard for quite some time that regular paper masks that aren't N95s are not effective. So is this a case where people need to start moving toward N95s or thinking about N95s as a daily piece of equipment they need to be using? And if that's the case, how do they acquire those, and which, you know, they aren't as readily available as some of the other masks people are using? Thank you.
Dr. Marsh, please answer.
Thank you, Governor, and thank you, Kenny. Kenny, we know that as I mentioned in my earlier comments, that probably the most important single factor for us to effectively protect people with the Omicron variant now as our dominant variant is to have people really focus on 2 vaccines and a booster. And the booster for those eligible appears to be really important. And we know that the potency of the immunizations are generally really good in the first 3 to 4 months and then start to reduce in their potency. And people who have been vaccinated and boosted, or people that have chosen not to be, then looking at the transmissibility, the infectiousness of the Omicron variant is very, very much higher than anything we've seen, in the order of 2.5 to 3.5 times as infectious as the Delta variant. And because it's so incredibly infectious is the reason why, for at least right now, as we're going through this surge with Omicron, we would heavily recommend people to upgrade the mask. If all you have are cloth masks, then a cloth mask is better than no mask. And we might suggest you double mask with the cloth mask to give you more protection. If you can upgrade to a surgical mask, which is 3 plies and fits around your ears, that's better than a cloth mask. A KN95, which is produced outside of the country, which is identified as a true KN95 by the labeling saying GB-2929- and then the year it's made. The most recent one is 2019. So that's a way you can say it's a real KN95 mask, which is a much higher barrier protection mask, 5 layers instead of 3, and some coating on it, which reduces the risk of getting aerosols inhaled. But the N95 mask, which is usually approved by NIOSH, the National Institutes of Occupational Safety and Health, is the best one. And as opposed to ear loops, it has 2 straps that goes around the back, because it's not only the barrier protection of the mask, but it's also the fit around the face that makes the biggest difference. So we would highly recommend people to upgrade to the best quality mask you can get. And I know the Biden administration is going to try to circulate around 400 million N95 level masks. But whatever you have, please wear. And if you're with a cloth mask, just try to double mask with 2 cloth masks if you have them, to provide extra care and try to get it to fit tightly across your face.
All right, thank you, Kenny. Next to Charles Young with West Virginia News.
Hi, this is Charles Young with WV News. I had a couple of questions about our hospital staffing situation. First of all, I was wondering if there has been any more serious consideration or discussion of additional Save Our Cares payments. And then, General Hoyer, you said that by the end of the day, we'd have 200 guardsmen assigned. I was wondering if you could give us an idea for the total ceiling. Is that something we plan on exponentially increasing? Do we know how many people we're going to be, throwing at that effort? Thank you.
Charles, I think, we can get the general to weigh in the beginning, but I want to make sure that we understand this. The Saving Our Care has now been backed up with the big nursing program incentives that we've got, going on, and so maybe, General, if you could come in and, we're trying to do all the different things to make sure that we backstop the staffing, But anyway, General, come in, please.
Yes, sir, Governor. So, Charles, if you remember, we did as we call it, a tabletop exercise early on, which on behalf of the Governor, Clay, and the Secretary, and Dr. Amjad and I participated in with the task force. At that point, we had projected with the hospitals the potential need for about 350 guardsmen. There is an additional effort going on with training with guard personnel right now. Those 200 will be now related to requests that have officially been made, and we have assigned bodies who will flow into those positions. They range everything from people who might provide screening support at the entry point to the hospitals, to helping with logistics support, moving patients, a variety of other things designed to give the opportunity for healthcare professionals to spend more time focused on patient care. I think Secretary Crouch had sent me a note this morning that we have over 1,000 hospital workers out today due to COVID restrictions right now. So right now we believe the 350 will work, but as always, and as Governor pointed out, the Guard's flexible, adaptable, and agile, and we'll work with that and other partners. And there are other things, as the Governor pointed out, that we are doing as part of his leadership team to relieve pressure off of our hospitals. Thank you.
Thank you, Charles. Governor, I'll turn it back to you.
Well, let me just kind of wrap up and as to what our experts have already told us today. I really hope that anyone and everyone that's out there listening, will pass this word on to others. But our coronavirus czar, Dr. Clay Marsh, first of all, I thank him for all the work and the assistance he did with me and lots of folks that he works with every day. But I want you to just listen to these words just a second. He said that the studies are out now that if you're 55 and older, you have a 44 times, can you imagine? If you had just a little bit more of a better chance of not being hospitalized, but what he's saying is if you're 55 and older and you've been vaccinated, you have a 44 times better chance of not being hospitalized if you get this. In addition to that, he said, if you're 65 and older, you have a 49 times better chance of not ending up in the hospital. I don't have any clue what in the world we could be waiting on. He also said that kids that are vaccinated have a 50 to 75% chance of not getting not getting COVID or Omicron or whatever in any way. So from the standpoint of our kids, and I'm talking to our parents now, from the standpoint of our kids that are vaccinated have an incredibly greater or less chance, rather, of getting COVID. Well, that's really important. That's really important. And from the standpoint of those 55 or 65 and older, you have a multiple times, from 44 to 49 times, good gracious, less chance of ending up in the hospital if you get this. You got to get boosted. You got to get your vaccinations. It's all I got. I wish to the Lord above that I could tell you, just don't worry about this. We got this little pill. You take this little pill one time and it's over. I wish to the God above I could tell you that. I prayed like crazy that we would get a vaccine. There was a time when this stuff was running rampant and we didn't know what it was all about, and we were all scared to death, and stuff was getting closed down everywhere, and we were somehow trying to piece together the government and keep everything running. We didn't know what to do. But I kept telling everybody, all we're trying to do is buy enough time to bridge us to get a vaccine. And now, by God above, and the work of a lot of really, really good people, we got it. We got the vaccine. And now we're still trying to urge people to take the vaccine. I am totally rock solid. You'll never have to worry about me being rock solid on the fact that I am so respectful of our freedoms. I am so respectful of your opinion. And absolutely, I'm going to stand rock solid there. But I'm telling you from Jim Justice's standpoint, you need to be getting that vaccine. And whatever you do, you need to get that booster. And you need to get it for our kids too. So with all that being said, the only last thing I'd add is just this one thing. the great general that's on all the time, you know, and the great work that they've done at the National Guard and you know, when he was at the helm and everything, and now they continue to do it under our Major General Crane and all the great stuff that he's doing, they are truly unbelievable. You know, William Farkas, on the way to West Point from the Mountaineer Challenge Academy, the at-risk kids and everything, that the great work of the National Guard's done. It's unbelievable. It's just unbelievable. But he said one other thing today. He said, do you remember back when they predicted, there was a group out of Washington State that predicted that there'd be 64 deaths in West Virginia. And at the time, I can't recall how many we had, but maybe it was 18 or 20 or whatever. And I thought, God forbid, it can't be 64. There's no way it can be 64. In a horrible mine disaster, you know, we lost 12 people or 11 people at Sago, and you know, and on and on. You know, it can't be 64. Well, today it's been 5,609. And General Hoyer just said to you just this. He said, the way this thing is going, we'll end up with 100 times 64. Think about that just a second. That's 6,400 people. 6,400 people, not 64. I couldn't believe I didn't want to tolerate it being 64. But 6,400, and you know what? We'll be really blessed. We'll be really blessed in West Virginia if we don't exceed that number too. Do you realize that every other day when we have a briefing, we're reading somewhere close to 40 names. So every other day, 20 briefings from now, if we continue at this pace, we'll read another 800 names. And 800 added to 5,600 is 6,409 people. In 20 more briefings, we'll be at 100 times the number that General Hoyer told us. I'm telling you, we have got to do everything in our power to stop this. It's not good. It's really not good. But for West Virginia to lose the potential of 6,400 West Virginians, it's unthinkable. Please help us. Please, please help us. And get vaccinated and get boosted. Thank you so much. That's all I've got. God bless each and every one of you.